Okay? All right.
Okay, we're rolling.
Hi, this is Dr. Bernstein with a special video teleseminar that we've put together in response to the COVID-19 viral epidemic and diabetes. Type 1 GRIT has had a number of questions with regard to the COVID epidemic and type 1 diabetes, and that's why we're putting this new video out. We'll try to have further updates. The date of today's video is March 23rd, 2020. What I'm telling you today could well be outdated within a week. So that's why we gave you a date. We're going to answer some questions, but first I want to refer you to a journal article that's going to be posted with the video from the International Journal of Antimicrobial Agents, March 2020, and this is a proof. It's not a final published version, but it's an advanced proof that's been put out because of some important information about both azithromycin and hydroxychloroquine, which we'll talk about later. First question, have you had any patients with COVID-19? What was their experience? I haven't had any certain patients. I had one patient who had some of the symptoms of COVID-19 after a plane trip, a lengthy plane trip, but he got progressively better over a period of 2 weeks. Now, did he really have COVID-19? We don't know. His doctor refused to prescribe hydroxychloroquine, but the doctor was anxious for him to take azithromycin. We're going to discuss this with in response to another question. I've seen a lot of information coming from the diabetes associations, wash hands, etc., but the issue of blood sugar is totally avoided. Why? What's your recommendation? Well, I can think of two reasons why the American Diabetes Association is not advocating normal blood sugars. One is that they've never advocated normal blood sugars. In fact, they advocate hemoglobin A1C values that correspond to blood sugars that are about double normal. And this appears to be to lower the likelihood of physicians getting sued for diabetics dying of hypoglycemia. The other aspect is at least the American Diabetes Association and likely the others don't know how to control blood sugars. So for them to ask the patients to have normal blood sugars is asking for the impossible as far as they're concerned. And of course, people who have read my book, Diabetes Solution, know how to control blood sugars, and there are darn good reasons for controlling blood sugars. COVID-19 is new. I'm curious about your experience with type 1 and influenza. Do normal blood sugars help? How do you manage sugars during the flu? Well, during the flu, we've seen many people over the years with elevated blood sugars, and some of them go very high. There are a number of things that we have to do, such as if you're taking insulin, we initially raise the basal insulin. In addition, we frequently prescribe metformin, an oral agent, because it can lower insulin resistance, and that may help. I don't have hard evidence that it helps prevent the blood sugar increases from the flu, but certainly the insulin increases help. Once we've increased the basal insulin, if blood sugars are still going up after meals, we may increase the insulin boluses for the meals. Now, if someone has raised their insulin doses while they have the flu, I have them checking their blood sugars more frequently, because as they get better from the flu, their insulin doses will come down to where they were before. So you have to be very careful as you recover from the flu. Another thing that you have to do if you have the flu is to remain hydrated. If you have a fever, you're likely to become dehydrated. If you have vomiting or diarrhea, you're likely to become dehydrated. So it means drinking a lot of fluid. And if you're supposed to be drinking fluid and you're nauseated, some people with the flu may be vomiting, you have to inject liquid Tygan. And that's a very important product that people should have on hand. We discovered that it's possible to run out of it because the doses which I measure in an insulin syringe might amount to 500 units in a day or two, and there's only 1,000 units in a vial of Tygan. Tygan is to stop vomiting, and you could run out of it. So we've been asking our patients to procure 3 vials of Tygan for just in case they get sick. And the big problem with Tygan is that it's very expensive. It can cost up to $300 a vial. And most insurers will not pay for it because it's expensive. So the cost is a very significant problem. And of course, Zofran is not as potent as injected Tygan. It is a possibility, and insurance may cover it, but the insurance usually only covers Zofran for a few doses given once a day. Why? Because Zofran was initially developed for treating people who are undergoing cancer chemotherapy that made them nauseated. And they usually get 1 dose before a chemotherapy session, and no more until the next chemotherapy session. So in the course of a month, maybe they'll have 2 or 3 doses, and that's what the insurance will pay for. Whereas if you have the flu, you may need several doses in a day, and you may have the nausea for several days, so you might not be covered for a full application of Zofran. Next question. What should we do? Special distancing, stay home as much as possible, total isolation? Well, I think that we have to do the maximum to not get infected. And that means not only adhering to what the local authorities tell you to do, but anticipating ahead of the local authorities, staying away from other people, especially if you're in a locality where there are cases of COVID-19 within 20 miles of your home. You shouldn't go to stores. you can frequently arrange for home delivery of groceries, drugs, etc., and take advantage of that. Don't invite people to your homes. Don't visit other people. Even other family members in other homes, stay away from them. If you have a family member across the street and they've really been isolated and not in contact with anyone else, maybe it's safe to walk across the street and see the family member. But even that is taking a chance. To give you the extent of care that I've taken for Joyce and myself, we had a food delivery, and the man came with a pen in hand for me to sign a visa receipt. Now, I wasn't anticipating that. I thought that because we gave the card number over the phone, that would all be taken care of. And he handed me a pen. I took his pen. I signed the paper. But he could have handed that pen to 50 different people before he came to see me. And I could have gotten infected, or I thought of that as soon as I had my hand on it. And I right away closed the door and washed my hands as soon as I had signed the paper. But now I know that if the doorbell rings, it might be a delivery, and I should be wearing gloves, and I should bring my own pen. So that's how careful you have to be. You really don't want to get infected. To worry about what you're going to do after you're infected is not nearly as efficient as preventing infection to begin with.
What about wiping down boxes?
Right. And you should have gloves on when you receive the packages. And another option, if you happen to have isopropyl rubbing alcohol on hand, or even 100 proof vodka on hand if you don't have isopropyl alcohol, you can load one of these plant sprayers, the little bottles with a squeeze lever on it, and you can spray the packages with alcohol. So that's some of the things.
That's what Roxanne.
Okay, well, that'll keep her busy for a while. Also, if you've been able to procure masks, if you come to the door and there's a delivery and there might be a human making the delivery, wear your mask. But that means being prepared before you go to the door, not after, like I did. Okay. In hospitals and emergency rooms, if hospitals and emergency rooms become overwhelmed with COVID-19 and our type 1 child gets sick and the 6-day protocol chapter does not solve it, is there further treatment we can do at home? For example, is there a way to do saline hydration at home, or would we have to risk the emergency room? Well, indeed, going to the emergency room is a big risk. For one thing, it may be a good place to get infected with COVID-19 if it's crowded. If your kid gets infected and needs a respirator, you're not going to be able to do it yourself unless you had a respirator. If he needs saline for some reason, for hydration, maybe he's got vomiting or diarrhea from another infection, or, as a matter of fact, there's some percentage of COVID infections start off with diarrhea. So you should have on hand low modal tablets and liquid, as we advocate in my book, for everybody. You should also have the Tygan, the injectable Tygan, as I mentioned before. And if you have someone in the immediate family who's a nurse or a doctor, you could keep on hand IV sets and even a stand for holding an IV bottle or an IV bag. Keep these in the house so that the medical professional in the home can administer the saline. That might save you going to the hospital. Certainly, you should not be going outside with groups of people. You shouldn't be meeting people at the bar if the bar is open. You shouldn't be congregating with people at beaches. This is sort of how the epidemic in Italy, which is now totally out of line, got started. The epidemic began in the north of Italy. The government warned the people in the north that there was an epidemic, did not give them any instructions. They rushed to the trains in crowds and went south in crowded trains, caught the infection from one another on the trains, and then gave it to the people in the south. So, common sense is very important in this pandemic, and doing things like I just described are causes of the problem. Type 1 and working the front line, how dangerous? Not that I have a choice. Well, if you're working the front line, it's dangerous even though you have protection. But if you don't have adequate protective gear, the odds are getting stacked up against you. To my knowledge, in the New York area where I live, there's only one hospital that has adequate protective gear for their healthcare workers and other supplies for the sick people. What are the most promising treatments with the least side effects? How about hydroxychloroquine and azithromycin? Well, there have been a number of papers demonstrating efficacy of hydroxychloroquine, which is one of several old agents used to treat malaria and then subsequently used to treat rheumatoid arthritis that they found were effective in stopping the attacks upon the lungs of the COVID virus. Basically, the COVID virus gets inhaled, attaches to cells in the lungs, and for many, but not all people, causes an autoimmune reaction where the cells of the lungs self-destruct. And the people who experience the self-destruction are the ones who die. And it appears that the hydroxychloroquine inhibits this self-destruction. Now, a very small study in France, which involved 20 patients who had been treated with hydroxychloroquine showed the possibility that azithromycin, which is a very widely used antibiotic, it's an overused antibiotic for reasons that I'll explain, of the 20 patients who were treated versus, let's say, another 20 who were not treated with the azithromycin, the 20 had clearance, rapid clearance of the infectious agent. I believe the specimens were almost totally cleared in 6 days. But those who received, 6 of those 20 patients received both hydroxychloroquine and azithromycin, and those 6 had more rapid clearance than the other 14 in the 20. So there is some evidence that azithromycin may accelerate the clearance of the virus. So here, both the hydroxychloroquine and the azithromycin don't just prevent the apoptosis of cells in the lungs, but they increase the clearance of the virus, so they may be antiviral. But there's a catch to azithromycin. Azithromycin is one of the broadest range antibiotics that we have, kills many organisms. And it's possibly in the USA anyway, more responsible than any other antibiotic for the resistant strains of bacteria. If you give a patient azithromycin, the first thing that's going to happen is you're going to knock out their microbiome. Most of you by now know what the microbiome is, but it's the bacteria that reside in your intestines. When you move your bowels, the stool that comes out is mostly bacteria. It's a piece of your microbiome. And you're first introduced to the microbiome if you were born by natural childbirth, vaginal delivery. You picked up bacteria from your mother via the delivery, and that bacteria start you off. They start off your microbiome. And then, over the first few years of life, you're exposed to infectious agents. You may pick them up from other people. You may pick them up from surfaces, from tabletops, from doorknobs, from other people who may be coughing. And your personal microbiome evolves with you, lives off of you, and is of benefit to you. It affects your immune system, it affects your endocrine system, it affects your neurologic system. So here you have these trillions of bacteria living inside of you that are keeping you alive so that they can stay alive. And the microbiome is important. And they found that there's some evidence that the people with the broadest collection of microbiome live the longest and are least likely to get sick. So you want to have your own natural microbiome, and you want as many of those organisms, many different organisms as possible. And you take azithromycin, broad spectrum, it's going to wipe out virtually all of them. And then, once they're wiped out, your microbiome protects you from new agents that might come along that might be harmful, such as Clostridium difficile, which can cause serious ailment, pseudomembranous colitis that could be fatal. So you're wiping out your microbiome, you're exposing yourself to new infections, some of which that could be fatal, and there's great hazard to this. Now, you therefore have, on the one hand, a small study that shows that it may increase the destruction of the COVID-19 virus, but we also know that it could also destroy your own microbiome. So if you are taking azithromycin in addition to the hydroxychloroquine, you should be taking a probiotic. It's not going to totally solve the problem, but it'll at least repopulate your intestines with bacteria that may be benign. The probiotic that we recommend is called Culturelle, Culturelle, and we recommend it to be taken one capsule for every dose of azithromycin, but not within less than 2 hours of the azithromycin dose, because the azithromycin will destroy the bacteria in the Culturelle. So you now have this dilemma. If you got an infection, first of all, you don't need to take these things unless you're exposed. If you're not exposed and not infected, there's no reason to take them. But I would take at least the hydroxychloroquine and question mark azithromycin if I were exposed, that is, in contact with someone who I knew had COVID-19, or if I started getting the symptoms. So it's not an easy answer, this particular question. It's something that I guess individuals have to decide. Now, we might find that in 2 weeks, some big studies will be done, and we'll know that the azithromycin may be a must. Or they may get a lot of C. difficile infections, and it's a no-no. We just don't know right now.
What about the side effects of drugs?
That's a good question. Over the long term, taking it for 6 months or a year, there's a nice collection of adverse effects that you could look up on the internet, but the current pandemic does not indicate the need for long-term treatment. You treat until you've killed the organism. Now, you may need it again if you get reinfected with a variant on the organism that comes along 3 or 12 months later. But again, the dosing is only for maybe 10 days to 3 weeks. And the adverse effect profile for 3 weeks use is not significant. So, for our purposes, you don't have to worry about the adverse effects.
And how do you get it?
Now, that's the next question. How do you get the hydroxychloroquine? I was fortunate for my patients in that I learned of the Chinese experience by seeing translations of some Chinese papers about a month ago. So my patients have been getting prescriptions for a month and were able to get it initially. Now it's no longer available because the President of the United States announced that it's available. Why they didn't announce it a month ago, I don't know, but now that it's been announced, it's being purchased by many people, and it's on back order. Now, it could be that the manufacturers are back into mass production, and maybe inventories will build up over the next 3 weeks. So what I suggest you do is get your doctor to fax the prescription to your pharmacy. The pharmacy will turn it down because they're out of stock. And you call the pharmacy and tell them to put you on the back order list. And then maybe they'll call you when it comes in. Maybe you'll have to call them. They'll let you know whether you have to call them. So you call them every 3 weeks until they get it in. That's about it. My son is type 1 with an A1C of 11%. His endo said, just stay home. What do you think? Well, first of all, an A1C of 11% is an average blood sugar of 340 milligrams per deciliter. How can an endo allow this to happen? Well, probably because they don't know how to treat type 1 diabetes. And I'd certainly recommend that you get my book. If your son stays home, as the endo suggests, and which I would also suggest, I would suggest that everyone in the family stay home, and that you also are careful about the incoming packages, the food deliveries or drug deliveries. I also suggest that you stock up on all the medications for your son and for anyone else in the family who may need medications. And I also suggest that you order my book, Diabetes Solution, and learn how to control his blood sugars. Now, the subject of blood sugar and susceptibility to infection is brought up in many of these questions, so I might as well answer the question now. Are diabetics more subject to the COVID-19 infection? My guess is yes. The warnings say that the people who are dying are disproportionately the elderly and those that have pre-existing conditions such as kidney disease, liver disease, diabetes, chronic obstructive pulmonary disease, etc. Now, is the diabetes on the list because more people are actually dying of COVID disease in proportion? I don't know. Are there any real statistics on this? I don't know. But we do know from general experience historically that diabetics are more susceptible to infections. Now, historically, this has been bacterial infections. Bacteria love glucose. So if you have a high blood sugar, you're asking for a bacterial infection. And I remember when I was a kid, and my blood sugars were always high, we did not have blood sugar self-monitoring, I would have boils. I'd get skin infections. And I had a girlfriend when I was 15, she was 15, I was 16. Her uncle had a boil and died of the infection from the boil. There were no antibiotics in those days. So we know that diabetics, it was common experience for them to get skin infections, and bacterial infections would proliferate. What's the story with viral infections? I haven't seen any studies indicating diabetics getting more viral infections. They may be out there, but I haven't stumbled upon them. I can understand why the immune system would be impaired by high blood sugars. For example, there are many active agents in the immune system, antibodies, cytokines, immune cells, etc., which can be damaged by glucose, and that may affect the immune system. I don't know if there are any long-term effects, but I certainly would expect that if you have a high blood sugar chronically, that large amount of glucose in your blood will predispose you to infections. Now that's my guess. It's just a guess. There's not hard evidence for viral infections, but I would guess that you are more susceptible.
What about adverse effects? Suppose you have viral infection.
Well, once you have a viral infection, almost inevitably, almost in every case, the blood sugars go up. And if the blood sugars go up high enough, you could get severely dehydrated and go into diabetic ketoacidosis. So you could end up getting killed by your diabetes because you're infected with a virus and you didn't take adequate measures to treat the viral infection and to keep blood sugars controlled while you're sick. Now, I've had probably over the past 30 years, thousands of people get viral infections, flu and the like. And it's very rare that anyone has had to go to a hospital. We just had one go a few weeks ago. A young lady whose Tygan ran out. She was vomiting. And she ran out of Tygan. And there was no way to get more rapidly because the pharmacies don't stock it. That is the injectable Tygan. So she had to go to the hospital, and in the hospital, they almost killed her multiple times. They started off by giving her IV glucose with insulin in it, but they, by the way, this was a world-famous hospital manned by hospitalists who frequently deal with type 1 diabetics. This type 1 diabetic goes in with a blood sugar of 90. She's very well controlled. And they give her enough glucose to get her blood sugar up to over 300 milligrams per deciliter. The hospitalist then gets panicky and gives her, as she was, when she arrived there, she was taking 1.5 units of Tresiba insulin as basal twice a day. The hospitalist ordered 35 units of Tresiba in one injection, where they didn't even tell the patient what they were giving her. The nurse just said, "You're getting some medication." She asked, "What is it?" She said, "When you see the doctor, you can ask him." And she started getting severe hypoglycemia all day long. And at that point, the doctor doesn't know what to do, so he calls me. And I said, "You got to bow out entirely. You let her take over. She knows how to treat herself. She has with her her own insulin and her bottles of liquid glucose. She knows exactly what to do, and if you leave her alone, you'll get off the hook." He was in such a panic, he let her alone, and we got her out. The next day, got her blood sugars rapidly stabilized, in spite of the fact that she had all this Tresiba insulin on her. She knew how much glucose to take, how often to check her blood sugars, etc., etc. And was taking glucose liquid by mouth all day long until they discharged her. They had to keep giving her the injectable Tygan. That was the only way she could get it.
So with the COVID-19, you got a situation where you or your kid has to go through. How is it possible that they're going to be able to manage blood sugars in such distress? It's scary.
That's right. If you end up going to the hospital, you're in danger of getting killed because of your diabetes. Totally separate from the COVID problem.
And I assume the parents aren't going to be allowed to go with kids if the kids want to help with blood sugar.
That's right. The parent could get infected by other people in the hospital. So this is serious business. And it's not just because diabetics may be more susceptible. It's because hospitalization for a diabetic is very dangerous. I have seen warnings about elderberry saying it can result in a cytokine storm. Well, this viewer is aware of the fact that I've been advocating the use of Sambucus lozenges for the treatment of viral infections in general. In fact, the PhD who invented the particular formula used in the Sambucus that we use says that she did a controlled trial with the SARS virus. And the SARS virus is similar to the COVID-19 virus. It's an RNA virus, and it has spikes on the surface that adhere to the cell that it's attacking. And she felt that she had evidence that the Sambucus impaired the ability of the spikes to form. So there's at least the testimony of the inventor of Sambucus that you should take it to prevent infection. So I've been recommending it and I've been recommending it for years for anybody who goes into a crowded area, because we know about people getting sick after they get off of airplanes because the air is recirculated. And I've many times told the story. My wife, daughter, and I were coming home from a visit to view an eclipse in Egypt, solar eclipse, and my wife did not like the taste of the Sambucus, and she wouldn't take it. My daughter and I took it before we entered the plane, and we took it in the middle of the flight, and there was a lady in our row who was coughing, and when we got off the flight, my wife was coughing, and she was sick for several days, for a week or two, and my daughter and I were fine. Now, that's not hard evidence, but I've seen many cases, including myself over and over, responding to the Sambucus. Now, this person is talking about warnings of a cytokine storm. Cytokines are substances made by the immune system that destroy invading organisms. And I guess the cytokine storm, in theory, would attack the person who's taking the Sambucus, but that's not what we find. And the particular brand, but I've only been using one brand. I've been using a brand that, first of all, has its own name. It's not called Sambucol anymore. It's called Sambucus, CUS. and it's made by a company called Nature's Way. And this is the formula that was devised in Israel. So that's the one that I recommend, and I think that if you're going to be in the vicinity of other people, you should take it.
Use that at onset, but once you get sick, you abandon it. Is that right?
No. Okay. You keep taking it. Keep taking it. It only works if you take it within 3 hours of exposure. Or 3 hours of the first symptom.
Then what? What about?
And then you keep doing it 2 every 6 hours. And you suck the lozenge. Now, I've had patients do all kinds of silly things because one had a mother who was a nurse, and the mother said, "Put it under your tongue," which is ridiculous. You suck it and let your saliva dissolve it, and you're trickling it down your throat.
Well, I mean, the concern is that Google around elderberry generates cytokines. COVID-19 supposedly kills you. Are overreactive cytokines, or you kind of kill yourself. Crazy. That's what's generating this question.
Well, I would use the sambucas because it seems to have antiviral effectiveness to the SARS virus, which is similar to the COVID-19 virus. They say to avoid NSAIDs, non-steroidal anti-inflammatories. That's like Motrin and ibuprofen. But we all know Tylenol can mess with our Dexcom readings, so many avoid. What do you say? Yes, the Tylenol can interfere with Dexcom readings. The Dexcom 5, but supposedly not the Dexcom 6. And again, what I usually use if someone needs to take something for a fever. Now, some fevers, mild fevers, can help destroy the infectious organism. It's a protective mechanism that the body has to kill invaders. But as the fever gets higher and higher, it can be more unpleasant for the victim, and it can put you to sleep where you may have to stay awake to be drinking fluids and so on. So, and if you have a fever, it's important to remain hydrated. So, the one agent that probably is the same, well, first of all, what's wrong with the NSAIDs? The NSAIDs, if you're already dehydrated, can injure the kidneys. So you don't want to take the NSAIDs. So what's left? There's aspirin. And aspirin has two caveats that are not very distressing. One caveat is that it will give a false positive test for ketones in your urine or your blood. So if you're keeping your blood sugars properly controlled, and if you're keeping yourself properly hydrated, and not eating if you're vomiting, you're going to have ketones anyway, but they're not doing any harm. You have starvation ketosis if you're not eating. Starvation ketosis kept our population alive during periods of famine because the ketones kept the brains alive, the brains of our prehistoric ancestors. So, testing for ketones, if you have normal blood sugars, isn't going to be of any value. So you keep your blood sugars normal, keep well hydrated. You can overdose on aspirin. I've indicated in my book that if you have too much alcohol with a meal, you will not be able to perform gluconeogenesis. If you eat protein at the meal, you won't be able to convert it to glucose, and you've taken insulin to cover that glucose from the protein, you could get severe hypoglycemia. Well, aspirin, like alcohol, can stop the liver from performing gluconeogenesis if you take an overdose. And an overdose would be more than 12 tablets for, let's say, 140-pound adults. And for a kid, it would be more than the proportion for a kid's weight. So if a kid weighed 70 pounds, it would be more than 6 tablets a day. If he weighed 35 pounds, it would be more than 3 tablets in a day. So a small kid might be better off taking the 81 milligram aspirin tablets instead of the 325 tablets. So that's basically it as far as taking care of fevers. By the way, as far as hydration goes, if you've been vomiting or having diarrhea, you should use a hydrating liquid that has electrolytes in it. It would be, oh God, what's the name of the stuff that I recommend? We use as a rehydrating agent for diarrhea and vomiting Powerade Zero, which we buy in the supermarket. Comes in 1-quart bottles. It's sugar-free, has no calories, but it's got electrolytes in it. So I advise people to keep at least 8 quarts of this stuff in their cellar or in a corner somewhere for emergencies. You could keep more if you have the room. It has a preservative in it, so it's good for a long time. Gatorade also has a calorie-free version, and these provide electrolytes. If you're sweating from fever, you usually don't need the extra electrolytes, but if you have diarrhea or vomiting, you will. I read that COVID-19 gets your immune system into a hyperstate mode, attacking healthy tissue in the lungs, causing major lung damage with death. That's pretty accurate. What does it mean for us with type 1 and other autoimmune diseases? Are we at greater risk? Well, I think that I've answered it. The reports are that more people are dying from the COVID-19 who have other conditions that include diabetes.
Well, let's take that question from a type 2 instead of type 1. What about, if you look at the comorbidities, they all seem to me like a large fraction of type 2.
Well, because there are probably 10 times as many type 2s as type 1s.
Well,
and they're also more likely to be elderly. So, it's not that type 1s are protected, in my opinion. It's just that they tend to be younger. And, yes, when they get older, they tend to be more sickly than the type 2s of the same age. But, if they've had high blood sugars.
What's your hunch on why obesity is a factor, heart disease is a factor, type 2 is a factor? Why do you think that is?
My guess is that that first of all, I suspect that there being a lot of glucose in contact with tissues, glycating essential proteins in your body, that you're impairing many systems, including the immune system. That's a guess. We know that the nerves are impaired. We know, I see virtually 100% of long-standing diabetics that come to see me have abnormal RR interval studies. I'm talking about what's called autonomic neuropathy. So the largest nerve of the body is injured by high blood sugars. And you could bet that a lot of other things are injured. We know that the brain is injured by high blood sugars. We know that MRI scans of the brain show abnormal areas in both type 1 and type 2 patients. We see this in both youth and in older people with diabetes. So perhaps every tissue in your body is adversely affected by the glucose. And why shouldn't the immune system be likewise impaired? That's guessing, that's all it is, but I think that we can expect this. Okay, here's another question. Thoughts about ACE inhibitors and ARBs. ARBs are angiotensin receptor blockers. These are drugs that are used to treat hypertension and or diabetic kidney disease. The American Diabetes Association recommends that all diabetics be given ACE inhibitors and statins. Of course, they're assuming that all diabetics are going to get kidney disease because they're following their recommendations for high blood sugars. But if you're receiving an ACE inhibitor, there is some speculation that they might protect against the invasion of COVID-19. Apparently there's a protein that the ACE inhibitors inhibit, and this protein appears in the lungs as binding sites for the COVID-19. So if you deprive it of the binding sites, maybe you'll prevent an infection. But there has also been speculation that the ARBs and ACE inhibitors may enhance the infection, may make the infection more likely. So it's really uncertain. And I would, at this point of uncertainty, suggest that you continue doing whatever you're doing. If you're taking ACE inhibitors, stick with it. If you're not taking them, don't start them on account of the COVID-19. Now that can change in a week. There could be more data coming up. Recommendations for levels of isolation distancing and how long. Type 1 diabetic homeschooled along with siblings. Dad is a pastor. My daughter's last A1C is 6.0. Well, first of all, this is a lot better than that 11.0 that the other child had. And 6.0 still corresponds to an average blood sugar of 140, which is about double the blood sugars of non-diabetic children, which run about 65 to 75. milligrams per deciliter. So the kid may be slightly more likely to get an infection, but of course we've heard that children are less likely to get infection than older people. Now, here the catch is that the father is a pastor. Is he going out to see his flock? And that could be very dangerous for the family. He should do what many other pastors are doing. He could do his job via Skype or telephone or email. He certainly should not be wandering out and being with groups of people, or even with individual people. What about, there are pastors in Italy conducting funeral services by Skype. So I think the biggest hazard for this family is allowing anyone to leave their home. I said that lack of exposure is the most important thing. If you don't get infected, you don't have to worry about the treatment. Can you estimate the time it takes for the immune system to recover from high blood sugar damage? Well, my guess is that there are two factors. There's the long-term glycation of proteins. There may be some proteins that are long-lived in the body that play a role in the immune system. Like collagen, I don't think collagen plays a role in the immune system, but it plays a role in most musculoskeletal systems, and also, by the way, in lung capacity. People get glycated collagen in their lungs, and they don't inflate as well as in non-diabetics. That can take 21 years and up to reverse. But my guess is that most of the susceptibility to infection relates to high levels of glucose in the blood. And that can be corrected very rapidly.
Hey, I got a question related to that.
Yeah.
But can you speculate on the diet that you recommend? Low carb diet is essentially protein foods and vegetables. So
no fruits.
No, protein foods.
Oh, protein foods. I thought you said fruits. Yeah.
And this is from a nutritional standpoint different from the high carb process. So what about the immune system effects, not just from the blood sugar, food that you speculate there?
I don't know, and I haven't even thought about it. I just don't know. I'm trying to think. I have most of my patients don't get sick, but the kids routinely over the course of a year, but the kids who go to school all get sick. And they get sick when their kids in their class are sick. However, those who take Sambucus when they go to school seem to be well even when most of the class is sick. Tips for a treatment plan if we have to go to hospital and are incapacitated. Well, I would suggest, one, that before you set foot in a hospital, that you have gloves and a mask, and that you have on your person multiple sets of gloves so that you can throw them away after exposed to surfaces or people or whatever. That you bring all your own diabetes supplies and essential medicines. What we found with hospitals is that they usually do not have the insulins that my patients use. They do not have regular insulin. They do not have susceptible insulin. They don't have diluted insulins, which most of my patients are using. So you bring all your own insulins, bring your own syringes. We have hospitals do not have half-unit insulin syringes. They may not have syringes with the longer needles for intramuscular shots because they've never given insulin intramuscularly. So my patients should also take whatever other essential medical supplies they have. If at all possible, they should be treating themselves. It may be possible that you could make a deal with the people who treat the COVID. You guys treat my COVID, I'll treat my diabetes. If that's to be done, they're much more likely to stay alive. Of course, if they're being treated for COVID and can barely breathe, they may not be able to treat their diabetes. That's a potential problem. If they bring a relative along to treat their diabetes, the relative could pick up the COVID from the other people in the hospital. So it's a real dilemma, and there's not magical solutions. A lot of it is common sense. You might have to be on your toes on how to handle one situation after another if you're in a hospital. You might want to make available the paper about my stay for a few hours in a hospital when I had elective surgery, how they repeatedly tried to kill me. And if I hadn't intervened for my own safety, I would have been dead multiple times. You know, it all started off with a nurse hooking me up to a glucose IV when my blood sugar was 85. She didn't know that. It was a he, really. It was a he who was almost 7 feet tall, and I couldn't fight with him. I calculated that over the 6-hour period he estimated I'd be hooked up to it, that I would end up with a blood sugar of 2,000. As soon as he walked away, I closed the clamp. And I was doing things like that throughout my waiting in the preparatory room and after I came to from the anesthesia. Make this available to the viewers. I think it's an important article. And this was a world famous hospital with huge federal funding for a diabetes center. Oh, this patient is asking about going to the hospital if incapacitated. I also thought of one other thing. You bring someone, a big person with a big mouth, who can fight with the doctors. Because if you're sick, you might not be able to cope with the doctors. But we find that people with a big mouth, and especially if they're of large size. Now, I had one young man who had his business partners with him. He was on the way to Europe when he got a dehydrating illness, did not have any of his medical supplies with him outside of his insulin, so he couldn't treat the dehydration, had to get hospitalized for IV Tygan, and I said to him, I'm warning him, remember, don't let them give you IV glucose. He says, you don't have to worry about a thing. If you saw the guys who are with me, you'd understand.
So I guess for days that means I got to bring patients.
Yeah, that's right. And a dog. How to best advise a symptomatic type 1 patient who does not have access to the hospital. Is dehydration a common issue with the course of COVID-19? Well, here's another case of the same thing. They should look at my article. And does not have access to the hospital. I'm sorry. So here is non-exposure, absolute non-exposure. If you don't get infected, you don't have to worry about going to the hospital. But you might possibly get other infections. Of course, if you're isolated, you're not likely to get the flu or anything else. So, should we be concerned about insulin supplies going forward? You should always be concerned about that, even if there's no COVID-19 epidemic. You never know when there could be a local or global catastrophe that makes any drug supply impaired. And since you need insulin to stay alive, you should have, I would say, a year's supply. This stuff does not deteriorate if kept refrigerated. And the expiration dates are usually always premature. Don't worry about the expiration dates. Now, I think I've gotten that message across in the past, too, before the COVID-19. Is there anything we can do to prevent this other than running normal blood sugars? I'm reading reports from China that indicate some people present early with diarrhea, lack of hunger, GI issues before the more commonly known respiratory fever symptoms. These patients are late to be diagnosed with COVID-19 and ultimately fare worse. Well, that's interesting to know. I didn't realize that, but I did know that some people were getting GI issues, and of course, we have to be prepared for those. So again, to have the Tygan, the low modal, the liquid, the tablets, the injectable Tygan, the liquid electrolytes, like the no-cal Gatorade, etc., Powerade Zero, all those things. You should always have those on hand, even if there's no COVID-19 infection going around.
What about vitamin D?
I generally recommend vitamin D to patients who are not exposed to the sun, which is almost every patient I treat, because even the people I'm treating on Bermuda, who live in Bermuda and have another home in Florida. They don't go out in the sun. They go from air-conditioned building to an air-conditioned car. So virtually all of my patients, including myself, get vitamin D supplements. And we base the amount of vitamin D on the blood level of vitamin D3. So several times a year, I measure my blood level, and I find that to get me up to a target level, I have to take 5,000 IU per day. And I have some people who could get away with 500. Some need 1,000. Some need 5,000. I think I have one or two who need 10,000. It's weird how people absorb it differently. One last question. Since the main reason behind isolation is not overwhelming hospitals, it is, if as type 1s we do get sick, we should stay home as long as possible. Given those circumstances, what can you do at home if you're sick to avoid hospital care as long as possible? And what sign should you really go in for? Well, I would say that it's a very good question, and it's not that easy to answer. I would say certainly if you're having trouble breathing. If you get a fever and don't have trouble breathing, you might be safer staying at home. But of course, the next day you could have trouble breathing, and it could be an emergency. So my guess is that if you have trouble breathing, you have to go to the hospital. But now you're exposed to a whole new slew of hazards. You know, what if you really don't have COVID-19? You got pneumonia. Now you're going to go to the hospital and catch COVID-19 from someone else. But nevertheless, if it were me, I guess I'd go if I had trouble breathing. That's it.
Okay, anything I missed you want to say?
Maybe I could make a summary. We could summarize by saying a few things. One, it's much better to avoid getting infected than attempting to treat the infection. And to do that, you need total isolation. And total isolation means in your home, with your family, no people going in and out, except if you're just going for a walk outside and there are no people out there. And don't take tips from people who are selling something. There are lots of vendors on the internet that are selling cures for COVID-19, selling their own diets for COVID-19. There's a lot of sleazy stuff going on. Be overly cautious. Don't think that being cautious is a sign of cowardice. It's a sign of wisdom. And you should maintain your isolation until there are no new cases within 20 miles of your home. Okay, so I guess we did it.